in Tokyo. I'll give you a little update on the vaccine rollout. And then we'll go into the end of the state of emergency and the end of these quasi-measures as well, as they have been imposed by the central government. We'll talk about what that means as well. And then I'll finish up with the new rules for incoming travelers. So why don't we go ahead and start off with our status report? Well, happy to report that it's still all good news. This was our COVID burden graph from 2 weeks ago when I talked to you last. And this is what it looks like now. So we actually have very few cases up here in the Tohoku area. Gifu Prefecture, which is right here in the middle of the state, is reporting 0 cases right now. 0 new cases right now. As are some prefectures out on the Pacific coast in the Kansai area. As well as Fukui Prefecture, Tottori, and Kagoshima way down in the south. So, as expected, it's taken us a while to get back here. We're seeing good pullback, starting in those farther flung rural areas. And, next week and the week after, I expect these pale areas to sort of encroach more and more onto the urban centers. This is our graph, how it looks now. So we still are on the downward slide here, yay. No real change in terms of that trajectory from last week. And that's borne out here by looking at our effective reproduction number again, which has actually stayed between 0.6 and 0.7 since now September 11th. So almost 21 days. Of being in that very nice, stable R effective number, well less than 1. I'm seeing a little uptick here. Yesterday was 0.6. Today it's 0.66. But, or I should say, on 9/27, it was 0.6. On 9/28, which is the last data that we have, it was 0.66. And again, I don't really put too much weight onto day-to-day changes of this. Again, the effective reproductive number is really just for trending purposes. So I say that this is no change. This is no change since the end of the first week of September. We're still in a phase where there's less and less virus being transmitted throughout the country. In terms of, 8 regions that are driving it, Kanto is still the big driver, followed by Kansai. Chubu and Kyushu have actually flipped again. So Kyushu, driven by Okinawa, is now in 3rd place, and Chubu is in 4th place. But really, the numbers are now getting so small that it's just really sort of small changes are driving those difference in places. Let me show you some more detail here. So one thing that I want to bring your eye to is that, as of a few days ago, there were actually more new cases in Osaka than Tokyo, which we haven't seen really, in a long while for this 5th wave. And these numbers are much, much, much better than even last week when Dr. Lomax talked to you. Certainly much better than 2 weeks ago than when I last talked to you as well. They're staying pretty low throughout all of these regions. The Kanto region up top, the Kansai region here in the middle, and really look how small the numbers are in the Kyushu region. Even their leader, Okinawa, only has 69 new cases. Fukuoka has 43. Kumamoto has 19, and Oita just has 10. Something had to come into that 4th spot, which is why it got a position here on this graphic at all. And check it out, Gifu has no active cases right now. And that's all borne out by the R effective numbers for each of these regions as well. Tokyo coming in at 0.62, Osaka coming at 0.69, Okinawa also 0.69, and Aichi at 0.6. So really, I mean, like there's a lot of a regional homogeneity right now in terms of the kibosh being put on the replication of the disease that really tracks and corroborates the national number here. All good news. All right. Hang tight 1 second. There we go. Okay, looking at the numbers on a per capita basis, and again, these are the case numbers on the right per 100,000 people in that prefecture. This is what we were looking at last week. Numbers, prefectures 1 to 21, we're still in the red, which NHK here is defined as more than 25 cases per 100,000 people. But really, from an EPI point of view, I think I had mentioned 2 weeks ago that what's more important to us is this traditional number of 50 cases per 100,000 people. And 50 cases per 100,000 people were only the top 8 prefectures as of 2 weeks ago. Let's have a look and see where we are now. Boom, look at that, much, much, much better. There are no prefectures now that have exceeded that magic number of 50 cases per 100,000 people. And in fact, there's, the vast majority, except for the top 2, Okinawa and Osaka, all the other prefectures are actually below 25 cases per 100,000 people. And this is great news. And it really signals, it illustrates the end of this 5th wave. Okay, looking at our variant watch, still there's really nothing much to report. Mu variation, mu mutant, has been poking its head up here and there. One of our breakthrough cases here at one of the institutions that I work at was a mu variant, but it wasn't associated with worse outcomes. It wasn't associated with any kind of traceable higher transmission. So mu remains a variant of interest, not particularly a variant of concern at this time. And we're not really seeing it like burn through areas and overtake Delta. So I think mu mutant is going to end up just being a cute name and not much else. Okay, critical illness here in Japan has also been tracking nicely. We continue to send people out of ICUs throughout the country on a day-by-day basis. So no great shakes there. This is what we want to see. By the way, just to remind everybody, you're going to see this pink line track upwards pretty soon as there's less and less people to actually discharge from ICUs. So eventually this will just sort of float back to hopefully 0 and won't exceed 0, which would mean that we're putting people back in the ICU. All right, and then here, deaths in Japan. This is really great. Despite how big the numbers were 3 weeks ago, 4 weeks ago, 5 weeks ago, despite how worried I was, working in the hospital here in Tokyo and seeing the ERs just sort of get overrun, the overall number of deaths here in Tokyo, even at the beginning of September, when we were kind of at our death peak, were no more than 100 deaths per day for the entire country. And it's fallen now to, about 30 deaths per day, 30 to 40 deaths per day, which is remarkable when you compare the death rates in other countries. And it's remarkable when you just say, hey, we're only logging 30 to 50 deaths a day in a country of 126 million people. This is remarkably low. And again, it's the vaccine effect. By taking out those people who are most susceptible to dying from this disease, Japan was able to really keep these numbers low, even though the rest of the, kind of infection numbers were high. All right, moving on to Tokyo here. This is what the website said 3 weeks ago. Even though we had started to see improvements, I had told you all that the infection is no longer spreading, and yet this is still on their website. So the website now says it's gone. They're not saying that it's spreading anymore. They've updated to say there's a high risk of resurgence of the virus. So basically saying, hey, everybody, we're in a good place, but caution is warranted. Don't go out and be foolish. Please, keep your highest vigilance. They've also written here that the provision of non-COVID healthcare is under pressure, so that, they want to reinforce that. We're not quite out of the woods. We haven't gone back to wholly normal operations at hospitals, because, even the hospitals, the COVID wards are still pulling away staff from the other wards. So not 100% of ORs are kind of back up and running quite yet. All right, in terms of the numbers here in Tokyo, this is what it looked like 2 weeks ago when I talked to you guys last time. There was an average of about 1,000 or 1,100 cases per day, and that's gone down to a pretty measly 300 cases per day. I just love staring at this graphic, 300 cases per day, again, in a city where the metro area is somewhere around 20 million people. That's pretty scant numbers of infection. Now, as I've told you all for the last, year, I always take infection numbers and I multiply it by 10 if I wanted to be kind of on the liberal side, and I multiply it by 100 if I want to be on the conservative side. And I say that number, that product. So in this case, anywhere from, say, 3,000 to 30,000 actually represents actual infection that's still out there. It's just uncaught. It's asymptomatic. It's just circulating quietly hither and thither. So, again, I think from thinking from that point of view is why everybody is still saying, hey, don't set up a block party in your residence and don't organize Tokyo Mardi Gras yet. Infection is still out there, and vigilance is appropriate. All right, here are the numbers for Tokyo. The new numbers in white juxtaposed against the numbers 2 weeks ago in blue. And just look at that. Look at the drop in hospitalized numbers from 3,000 people 2 weeks ago to, less than half of that number, 1,181 people hospitalized as of yesterday. Just a remarkable drop. And the speed of the drop is even surprising to me. And we've seen, it's not just that people are no longer being hospitalized, that they're being sent home. We're seeing drops in all categories: mild to moderate symptoms, severe symptoms, recovering at designated hotels, and people recovering at home. So this tracks with all the other indicators that we're seeing. And in terms of our provisions here, the positivity rate has dropped further to a pretty measly 3.3% from 8.6%. Hospital beds haven't changed in number. ICU beds haven't changed in numbers, but the numerators have changed significantly. So our floor bed occupancy here in Tokyo is now under 20%. It's 17.9%. And our ICU bed occupancy is kind of hovering, around 21%, as it has for, at least since the beginning of the week. This is great, but this kind of gives us pause, because when people talk about strain on hospital systems, they're really looking for that bed occupancy rates should be less than 10%. Less than 10% of floor beds, less than 10% of ICU beds should be occupied by COVID patients. So we're not quite there yet. So from that point of view, I really do understand why the Tokyo website is still saying that, there is a level of strain that's still on the medical systems here. And this is what you're seeing here. Nobody's going to go back to normal until these numbers are less than 10%. Okay, vaccine rollout. Well, there's really nothing much to report. Everybody knows how well Japan has done in terms of ramping up in a very short period of time the vaccines. So this is what we are. This is where we were 2 weeks ago. 64% of people had gotten at least one dose. 52% of people had gotten 2 doses. And here's where we are as of today. So this data was just released today. 70%, and even 70% have gotten 1 dose, and 59.3% have gotten 2 doses. So we're getting there, folks. I remember talking to y'all 2 weeks ago and saying, hey, it's not over yet. And I showed you those numbers about interest among young people who still want to get vaccinated. It's still happening. It's still happening. So expect Japan to kind of end up in the 70 to 75% vaccination final rate. And I think over the next 2 to 4 weeks, that'll be borne out. Here's where Japan compares against some of its peers. So Japan is right here in the number 2 spot. They've overtaken the United States, which is demonstrating about 55% of people having gotten 2 doses. To Japan's 59%. And one thing to kind of note here is that the light green bar, which are people who have only gotten 1 dose, is starting to get smaller, right? So that means that the 2-dose folks are catching up to the 1-dose folks. And that is a proxy for interest. So I think what the United States will end up at is kind of, in the sort of 65 to 68% range for vaccine rate. If you look at Australia, vaccination still has legs there. It would be my guess. And that's because you have a larger proportion of people who have only gotten 1 dose. You've got to, sort of fill in that gap, get all those people their 2nd dose, which also kind of still gives you room and time for more people to get their 1st dose. Now, if we look at Japan, we're kind of closing in on these 1st dose people. So the 2-dose people in the dark green are starting to close in on the light green 1-dose people. But it's still a larger gap than what we see here in the United States. And that's why I think that it's still got legs here. I think we'll probably end up at 70 to 75% total vaccination rate. The United Kingdom, the 1-shot people are they're a pretty small percentage now at 5.8%. So I think the UK will probably end up 70 to 73% when all is said and done. So the UK and Japan I think they'll be pretty equal in terms of a very respectable total vaccination rate, just in time for boosters. And I'll spend more time on this in a couple of weeks. And in a couple of weeks, I'm planning to talk to everybody about some vaccine-oriented things that I want people to think about as you start approaching booster time. And this is one of the things that I was going to show you. I just thought it was cool, and I wanted to talk about it now. This is actually from the Kosei Roadshow, the health ministry, and they have enough data now to compare side effects in Japanese people who got Pfizer, which is on the left here in the lavender, and Moderna, which is in the pink here on the right. And the top graphic here is are basically pain side effects. Not severe pain, kind of light pain, the pain that we feel after vaccinations. And there's not really much difference between Pfizer. After you get your 1st dose, 93% of Japanese reported some sort of vaccine-related pain, and about 90% after their second one. And if we look at Moderna, it's pretty similar: 86 after their first dose and 88 after the second dose. But but it changes. The second line here is Kentaikon. It's fatigue, that deep fatigue that you get after a vaccine sometimes. After the first dose, it's pretty similar between Pfizer and Moderna. But after the second dose, the Moderna shot, has 20, almost 20% more sort of associated fatigue. Similarly, the third line here is headache. There's almost a 20% increase in headache with Moderna. Not much difference with itching. This is that fourth line, Kayumi. And then the final line is Hatsunetsu, it's fever. And this is fever greater than 38 degrees. Look at this. So only 21.3% of people who got the Pfizer vaccine had a fever higher than 38 degrees after their second dose. Whereas a whopping 62% of people who got the Moderna had, a clinically significant fever. Now, again, 60% of people get a fever after a vaccine. I'm not that surprised. What I am surprised about is this difference, 20% for Pfizer versus 60% for Moderna. That's a really big difference. And I think because of that, we'll see some differences in recommendations for booster doses. Pfizer will probably be full dose boosters. Moderna, it looks like, is going to end up being half-dose boosters. But I want to talk to you guys. I'll remind you of this slide in about 4 weeks from now when we talk about some more vaccine-specific things again. All right. Okay. All right, so let's talk about the end of the state of emergency and the end of these quasi-measures. So, as everybody knows, on September 28th, it was sort of announced that actually on the night of the 27th, which is Monday, reported on the 28th, that Japan was going to lift the state of emergency nationwide. And everybody was pretty happy about that. Nobody was particularly surprised. We'd all been expecting this for a couple of weeks, again, given all these good numbers that we were seeing. So let's just kind of review the state of emergency. So the state of emergency kind of came down from the central government. Remember, mambo, or these kind of lighter restrictions, these mambo restrictions are local, municipal, and prefectural. But the state of emergency needs to be declared by the central government. So it's sort of a heavier blanket, if you will. It was declared in April of 2021, at least in this last iteration. And it's currently in effect in 19 prefectures, and it'll be in effect for the next 5 hours and 6 minutes in 19 prefectures. It started in 4 prefectures. In April, it was expanded to 29 prefectures during that 4th wave. It fell to 1 prefecture, which was just Okinawa, during the early summer, if people remember, back in June. And then it was expanded again to the 19 prefectures that it currently is. In addition, 8 prefectures have a kind of quasi-state of emergency. So they're lighter restrictions, but they're still being imposed by the central government, rather than just being up to governors or local leadership. But what's interesting is that even though the official state of emergency has only been in place kind of since April, Tokyo has been in some kind of state of emergency or mambo, quasi-emergency or local emergency measures since February of 2021. There's only been 28 days in the year to date that Tokyo has not been in some kind of restriction. So this is big news that finally, kind of like things are lifting. And what has that meant for us over this time? Well, of course, barring some public events like spectators at the Olympics, limiting the number of spectators at some other large events, baseball games, soccer games, things like that. Restaurant closures, as everybody knows, by 8 p.m., last call for food at 7 p.m., and restriction on the number of people dining together, which currently, at least for Tokyo, is 2 people. And of course, this sort of alcohol ban has been unpleasant for a lot of people. Okay, so what are the changes that are going to be happening? So as I said, the state of emergency will be lifted in all 19 prefectures. The quasi-measures will be lifted in all 8 prefectures. In its most immediate effect that you and I will feel is that restaurants will be open until 9 p.m. instead of 8 p.m. Probably a last call at 8 o'clock, closure at 9 o'clock. But at least it's going to be a lot more fun until 8 o'clock because alcohol will be back on the menu. So, it sounds superficial because it sort of is superficial in that sense. This is a quality of life change for a lot of people who do want to go out with their colleagues, their families, their friends, and have a good time out there and feel like the world is going back to normal. But what the lifting really is a political maneuver. It's not really a health maneuver. And I know that Tom and I are physicians, and we like to talk about health issues and biological issues, but this is not that. This is a political maneuver. What the central government is saying is that we are ceding power, we are ceding responsibility, we are ceding policymaking back to the local prefectures. That's all that this is. They're now saying the ball's back in the local government's court. And really that means the prefectural governments. You might have seen earlier this week, I think on Tuesday, the governor of Kanagawa and the governor of Tokyo, Koike, they put out a statement on the same day saying, we hope that the central government will tell us when it's okay to remove further restrictions. That was also a political ploy. The state of emergency lifting gives them that power to make that decision how and when they want to restrict or pull back these restrictions. The political ploy of it is that they don't want that responsibility all on their shoulders. They want the government, the central government, to be at least partially responsible when things go bad. Whether it's for the guidance that they received or whether it's for the actual nuts and bolts of how it's being pulled back. So they put out this statement sort of saying, hey, I hope the central government will tell us what, when and how we can do this. Well, the central government will continue to play a heavy-handed role in Tokyo and Osaka and some of those larger urban centers where there's a higher chance for resurgence. But really they're stepping out of the responsibility role here, and it's going to be increasingly up to the prefectural governments to implement local and municipal specific restrictions and also ease that back. So the goal really here is to gradually return to a state of normalcy. And I think that ultimately everybody wants that. The central government wants that, the prefectural governors want that, and of course the municipalities want that. And we want that because we all want to get back to normal life, but municipalities also want their businesses to reopen and start regenerating tax revenue and all that good stuff that comes with a healthy and thriving economic environment. So what'll that look like here for Tokyo, for example? Well, Tokyo is going to start off with allowing groups of people to dine together in groups of 4 or less. Instead of 2 or less, it's going to be 4 or less, and alcohol will be served at least until the close of business. On the larger scale, it looks like vaccine passports. So these Japanese vaccine certifications will be necessary at certain large public events, maybe some sporting events, maybe fairs and matsuri, these large matsuri that are hosted at Yoyogi Park and things like that. It's likely that depending on the municipality, depending on the prefecture, you'll need to show some kind of proof of vaccination to get into some of these types of large public gatherings. So that's the way this is going to affect you and me. Details will be forthcoming. Details will be forthcoming over the next couple of weeks as the municipal governments start putting together their task forces to kind of take over the policy-making part of this. They'll vary pretty significantly from area to area, prefecture to prefecture. So expect, once again, kind of similar to how things were last fall, that the rules in Kanagawa might be very different from the rules in Tokyo. And in Tokyo, you can't drink. But if you go across the street and you're now in Kanagawa, you can drink until midnight. So I think we're going to probably go back to a little bit of that variability. Okay, and then finally, I want to talk about these new rules for incoming travelers. And I call this the old, the new, and the ugly. So back in May of 2021, I showed you this slide, and it showed that there were 152 countries, including G8 partners, which are highlighted here, where people were just not allowed to come from. And at that time, even if you were not a Japanese citizen, but if you were a resident here, a normal resident, business resident, there were some roadblocks, whether you could come back or not, or how easily you could come back. Well, that hasn't really changed. In fact, as of today, there's now not 152 countries, there's 159 countries from which travel is not allowed. But that's if you're a non-resident. So who are we talking about here? We're talking about new hires. We're talking about business travelers who don't have their sort of home base here in Japan, and we're talking about tourists. So those people, still for the foreseeable future, will not be able to enter the country. All right. So, if you're talking to friends at home, if you're talking to family at home, and they're sort of saying, hey, maybe we'll get finally to Japan this, late fall, this winter, it's not looking very likely right now. But what if you're a Japanese citizen, or what if you're a normal resident here? Maybe you're a permanent resident. Maybe you're on a spouse visa. Maybe you're on a work visa here, and this is your primary residence for right now. Well, in that case, the ban applies to 0 countries. You can now come back into Japan from really anywhere in the world. So, that represents a little bit of a loosening. But once you get into Japan, what happens? Okay, so before, I guess for the next 5 hours, 4 hours and 55 minutes, this is how it's been, right? There's been this 14-day mandatory quarantine, either in your home or a government facility or a hotel. And certain people definitely needed to go to a government facility based on what country they were coming in from, for either 10 days. And right now, as it stands right now, there's no countries that are being required to stay for 10 days in a government facility. But then there's also the 6-day in a government facility option. And here are some of the countries that are subject to that. And then there's the 3-day in a government facility option, and 40 countries are currently under that. So, whether you're staying 3 days, 6 days, or 10 days in a government facility, well, it's a little draconian. How's that going to change? Okay, so as of tomorrow, home quarantine will be the norm for most countries. Some high prevalence countries may still have the 3-day in government quarters. It looks like that's going to be Philippines, Brazil, Peru, maybe a few other ones. We'll get clarity on that tomorrow, maybe through next week as well. But by and large, people are going to be allowed to home quarantine, and I think that that's a big difference. Rather than going to a government facility, being able to go to a hotel or home. Okay, so when you're in quarantine now, what are the new rules for that? So the government is finally differentiating between unvaccinated and vaccinated. All right, I guess it happened to the Japanese, so now they're convinced it's good for the rest of the world. Let's start with the unvaccinated people. If you're unvaccinated, including your children under 12 years old, of course, you need your 72-hour pre-arrival test. You need your airport on-arrival test. And then you're going to go to this home quarantine for 14 days. That doesn't change. If you're unvaccinated, that doesn't change. You're still in the clink for 14 days. That means your kids are still in the clink for 14 days. So unfortunately, it doesn't change for the little ones or those who can't or won't take the vaccine. Now let's look at the vaccinated people. All right, so vaccinated people also have the same option. If you're vaccinated, you have to do your 72-hour pre-arrival test. You've got to do your airport test. And you know what? If you want to chill at home for 2 weeks before going back to the office, you can. You basically then just do nothing, right? Do nothing, stay at home for 14 days, and your little OCHA app, which is the software app that sort of tracks you, will turn from red to green on the 14th day, technically on the 15th day, the first minute of the 15th day. And then it'll say, you're okay to leave quarantine, all right? So some people will undoubtedly do that. But let's say you want to get out a little bit earlier. Well, there's going to be this new option. It's the 10-day test option. So what you can do is while you're chilling at home or in your hotel for the first 10 days, you can get onto the government website and it'll direct you to authorized testing centers. And I'll tell you a little bit about that on the next slide. The authorized testing center will book you for an appointment. And right now, all of these machinations are in Japanese, but hopefully multilingual sites will be up fairly soon once it gets up and running. And you can book an appointment for this 10-day test. The 10-day test is either a PCR or a quantitative antigen test, not a qualitative. The quantitative one takes a little more technology. It's a little longer to report results. You can leave your quarantine just to go to this testing site, get your test, and then you got to go right back home or right back to hotel into quarantine. And depending on when you got the test, you'll either get the results later that same day or maybe the next day. And if you're negative, yay, you're out. So you could theoretically get out on the evening of the 10th day, but more likely it's going to be on the 11th day. So what does this do? What does this loosening do? It saves you 3 days, saves you 3 days. People have to weigh the balance, the saving of 3 days versus the cost of, your own transportation to the testing site, the cost of the test. This test is optional, so it's totally on you. The government is not getting involved in paying for this. Probably as we've seen for this whole year and a half, prices will vary between low-cost testing and higher-cost testing. The government isn't finished authorizing different centers for testing either. So there's going to probably be a little bit of planning that needs to be done over the next couple of weeks before this truly gets implemented. So what does proof of vaccination mean for you to be eligible for this 10-day option? Well, it has to be a Japan-issued vaccine passport, so something that you've applied through your municipal office already. Or it can be a Japan-recognized vaccine certificate. So what does that mean? Well, that means that it must say that you either got Pfizer, Moderna, or AstraZeneca. So a Japan recognized vaccine. They won't accept Johnson & Johnson, and they certainly won't accept Sinovac, Sputnik, the other Chinese one. Those are off the table. So it's got to be one of these three: Pfizer, Moderna, AstraZeneca. So please be careful about that. And they are saying right now that they will accept CDC cards from the United States. I think they'll probably give kind of more recognition to their passport partner countries. I told you 2 weeks ago about how they hammered out these deals with 17 other countries around the world. They'll probably give them a little bit of priority, but right now, the details of all this are only on one government website. They're all in Japanese, and honestly, they're pretty sparse. So expect more details about what will be accepted as proof of vaccination over the next couple of weeks. All right. The testing, like I said, must be done at a government-approved facility. And right now, the only thing that this government document says is Kinoshita Group. And Kinoshita Group is this kind of network of labs. They supported the testing for 2 million people associated with the Olympics. Right now, they're probably going to give Kinoshita Group the approval. They might give LSI and some other labs approval. So we'll know more about the accessibility to this 10-day test fairly soon. Of course, everybody should keep in mind you have to travel to the facility by private transport. Private transport is okay. No public transportation for that whole 14 days. That doesn't change from how things are now. Like I said, it's self-pay and costs are a little unclear at this time. And the turnaround time will be probably around 24 hours. What I'm hearing from a couple of friends who are closer to this is that if people get tested earlier in the day and it's not especially busy, you could theoretically get your test results by close of business. But more likely, it's going to be 24 hours later. So in the morning, it'll probably be the next morning that you get results. If you get tested in the afternoon, it'll kind of be midday the next day that you get your results. So that's kind of where it stands for right now. So let me just take the last couple of minutes to say what hasn't changed here. Well, long and short-term visa suspensions are still in place. That language and verbiage hasn't changed from the MOFA website. It's been in place since January of 2021, and they're not looking to change it for right now. There's a suspension of the visa exemption programs from partner countries. That's not on the books right now to be re-upped with any kind of priority. And there's still the suspension of the residence track and the business track frameworks for longer term visas. So nothing's changed there for right now. Pre-arrival testing, still, it needs to be a PCR or a quantitative antigen test, nasopharyngeal or saliva. So the strictness of that hasn't changed. They're still not doing what other countries are doing, which is saying you can do a home test like Binax Now, PanBio, ID Now, something like that. They are not loosening that restriction. Once inside the country, you still need to do that written pledge, and I put the link there. You need to abide by the quarantine rules, avoid public transportation for 14 days, and then using the smartphone apps, report your health condition daily and be available for tracking, location tracking, and a video call if they don't believe you're actually where you say you are. And finally, last slide, can we expect further loosening of these restrictions? Well, it's complicated. I think yes, eventually we can, but when? Well, as everybody knows, there's a general election on around somewhere in the vicinity of November 10th to November 28th. And with the administration changing so recently, really just yesterday, Kishida will likely be our new prime minister. He just was elected head of the LDP. I don't think there's going to be big changes that are then pushed through beyond what I've talked to you about today, for a couple of reasons. One, the new administration is going to want time to track the changes that come from these changes, right? You're going to want to see, does it work? Logistically, does it work? How do numbers change? And maybe more importantly, they're not going to want to get egg on their face if these small changes somehow lead to a sixth wave very quickly. They're not going to be the ones who are going to take the fall or take the blame for that before this general election in November. So I'd say these are the changes that are going to happen, and this is probably the way it's going to be for the next 2 months. And then we'll see for December and for January if there's further loosening that happens based on case numbers. All right, so that is my 2 cents for today. Thank you very much for sticking with me, and of course, let us know what topics you'd like us to cover, and shoot me an email if you have any questions or comments. All right, and we have plenty of time for question and answer today, so let her rip.
Yeah, thanks very much, Galton. So let's move directly to first question from Sabirol, who's the head of St. Mary's. Is there a disproportionate growth of positive COVID-19 cases in the sub-12-year-old group in Japan? So one of the things that I'd said was that I was kind of concerned that with Delta being intrinsically more contagious, and that group being unvaccinated, we'd see COVID sort of shifting more to spread within schools. So I guess he's asking, has that happened? I don't know if you've seen any data on that, Gautam, or...
Yeah, there has been. Tom, I think last week, and I not 2 weeks ago, maybe 4 weeks ago, when I talked to you guys, we showed you this Tokyo graph of hospitalizations, and each age group was color coded, and the proportion of shrinking of people going to hospital and people going to ICU for the 90-year-olds, the 80-year-olds, the 70-year-olds, and the 60-year-olds was like shrinking to almost nothing. Like you could hardly distinguish between those age groups. And because of that, the other age groups, including children under 10, the proportion of those people were rising. So yeah, you could call that a disproportionate growth of cases, and in that case, in those graphs, cases that ended up needing hospital or needing ICU, that's more representative of younger people now who don't have the vaccine. That's my take on it. Tom?
If you want to, actually, I've got the data here. I just managed to find it on the Health Ministry website, which I've not used before. But if you want to make me host, I can put it up, show you. Just basically, it kind of confirms what you just said.
Yep, I think you should be able to share. I put it for all panelists.
Just a second. So
let me stop my share.
And then share screen. Okay, so can you see that?
Good to go.
Yeah, so this is the Health Ministry statistics. It's quite good, actually. I've not used it so far because I've used other sites. But this third plot on the right here, number of newly confirmed cases by sex and age weekly. So this is the week up to 28th of September, so last week. What was the distribution of new cases by age and gender? So just as Dr. Deshpande said, you see that there's the top 4 bars, over 60s, over 70s, over 80s, over 90s, are the smallest numbers. And I mean, those are the people who've been most the vaccine uptake's been the highest, has been over 90% now, I think. And then number of cases increases as you go down 50s, 40s, 30s, 20s, and still, I mean, as has been the case throughout, the highest number of cases is in people in their 20s. So it's this final bar here, the one on the bottom, under 10s. So has that significantly increased because obviously everyone under 10 is no one's vaccinated in that age group at the moment. So those are, purely from a sort of vaccinated, unvaccinated perspective, the sort of most vulnerable, but historically have been the least likely to catch COVID. So if you want to sort of see, since the whole thing started, I think this is cumulative here, this one in the middle now. So this is since the beginning of the pandemic. And you can see there were like 46,000 cases in people under 10, but that is probably about 20% of the number of cases of people in their 20s. So how's that changed? Well, last week, it's from like 20% of the number of cases of people in their 20s to about half. So there does appear to have been a modest proportional shift of cases to under 10s, but not a sort of explosive growth, I guess I'd say.
Yeah, that's a great visual representation of that.
Yeah, and again, this sort of shows the sort of minor gender disparity as well, but that's not something we've known about for some time. So that was the first question in chat, and there's one more. Given that restrictions imposed, this is to you, I think, given that restrictions imposed by the state of emergency were largely unchanged, would you attribute the sharp decline in cases only to increases in vaccinations, or are there other factors at play, i.e. people taking the virus more seriously due to media reporting or other reasons? So what do you think? Is it just the vaccine, or is it the state of emergency, or is it some combination?
Yeah, it's always, I feel like this is a board's question, and the right answer is always multifactorial. And absolutely, there's a lot of, recently I've been my eyes have been more attuned to clickbaity articles that just in the effort to get eyes on them, say, rather than vaccines, this is why case numbers are falling. But it's not that simple. It's a combination of vaccines, as you mentioned, but also people, and by people I really mean people in their 40s, 30s, and 20s who kind of self-restricted their behavior. Let's say starting from the beginning of September when things got really bad, and when all these other news media stories started coming out about how bad the situation was getting in hospitals and stuff. And there's a lot of data to suggest that these sort of like middle-aged or young people really started curbing some of their going out, really started curbing some of their behaviors. So multifactorial.
Yeah, definitely. I mean, I guess people always sort of say, oh, there's a state of emergency, but I saw people drinking in a bar. That means it's being ignored and it's not working. I mean, even like right at the beginning last year, they were only talking about like 80% reduction in risky behavior. And I mean, whether the most recent state of emergency achieved 80% or not, I don't know. But there definitely was a decrease in sort of behaviors that increase risk of spreading, whether that's people drinking, eating and drinking in crowded locations, or super spreader events like big sports events. I mean, there definitely was some significant downward pressure from that side. And I'm sure the vaccine contributed as well. Can you give a percentage, like it was 60% the vaccine and 40% the state of emergency, or vice versa? No, it's very hard to unpick that. And I think everyone will have their own opinion. But I think anyone who says the vaccine had no relation to the drop in cases is clearly wrong. And anyone who said that it's entirely down to the vaccine, again, I dispute that.
Yep.
Multifactorial.
Absolutely.
Good. Okay, so I think that's everything we've got in chat. Just a minute. The Health Ministry wants to kick me out. Do we have anything in Q&A? Any more questions? Or are we done?
Yep, I don't see any Q&A questions. Anything else out there?
I think that wraps it up then. Great, thank you very much.
All right, great. Thanks so much for joining, everybody, and stay healthy and keep everybody healthy around you. And thanks to Tom and Tokyo Medical Surgical Clinic once again.
Okay, I will see you all next week for the first post-emergency talk in a long time.
Yeah. Okay. Bye, everybody.
Bye-bye. Good night.